Who pays for Medicare Part D catastrophic costs? If you are a senior navigating the world of Medicare, you may be curious about how costs are shared when it comes to prescription drugs. Let's break down who pays for those catastrophic costs under Medicare Part D. When you reach the catastrophic coverage phase of Medicare Part D, the financial responsibility shifts. This phase kicks in after you have spent a certain amount out of pocket on your medications. As of 2025, that threshold is capped at $2,000. Once you hit this limit, you enter a new phase where your costs change significantly. In this phase, the costs of your prescription drugs are shared among three key players: Medicare, your Part D plan, and drug manufacturers. Here's how it works. Your Part D plan, which is a private insurance plan, covers 60% of the drug costs. This means they take on the majority of the financial burden during this phase. Next, drug manufacturers step in to help. They provide a 20% discount on brand name drugs. This discount is a way for them to support seniors who may be facing high medication costs. Finally, Medicare covers the remaining 20% of the costs. This structure is a shift from previous years when Medicare used to pay a larger share, sometimes up to 80%. The goal of this change is to lessen the financial load on Medicare while ensuring that beneficiaries still receive support. One of the best parts of entering the catastrophic phase is that you pay nothing for covered medications for the rest of the calendar year. This is a significant relief for many seniors who are relying on multiple prescriptions. Before 2024, beneficiaries were responsible for a 5% coinsurance during this phase. However, this requirement has been eliminated, further reducing out-of-pocket expenses for seniors. It is also important to note that the coverage gap, often referred to as the donut hole, will be eliminated in 2025. This means you will no longer face increased costs as you transition from the initial coverage phase to catastrophic coverage. Overall, these changes mean that Part D plans now carry a larger share of catastrophic drug costs. This may influence how these plans are structured and priced. However, for seniors, these adjustments provide better financial protection by capping out-of-pocket expenses and reducing costs during the most expensive coverage phase.